We'd like to move back to Carole Finkletaub. Is she ready to present her prize?
Carole is poised and ready.
Super. Well, can I just quickly introduce Carole? She's here to present an annual prize for the Best Student Project in 2020. Her son, Daniel, who had Marfan syndrome, made a huge contribution to the success of the Marfan Trust in the role of our treasurer for many years. I think you will all agree that the presentation by Mohammed and Thomas is very helpful to doctors and patients alike, as we all manage Marfan syndrome during COVID. The students have agreed to split the award, and Mrs. Finkletaub would like to say a few words of thanks. Hello, Carole.
I can only say congratulations to both the students. I've already sent their prizes off together with a nice thank you. And, you know, they've worked very, very hard, especially Mohammed. I mean, is that not unusual for a doctor with Marfan syndrome to take that road, that career step?
It is, and he's a shining example. And I hope that a lot of the parents whose children have Marfan who are watching today take it to heart, because we have patients with Marfan syndrome in many positions of responsibility. Your own son certainly helped put our books in order, and we're very, very grateful to him. We're thriving.
Yeah, and it didn't stop him from traveling and doing things, except, as you know, when Marfan took hold of him completely. But he had a good life, you know, and we're very, very, very positive. In fact, this is quite off the board, but hopefully I'm going to America in December to see Millie, Asha, Elaine and Tony, because I haven't been for nearly 2 years. And I've got some of Daniel's memorabilia here, and I'm going to take it and see if the children want to split it between them, you know.
Excellent.
We often talk about him. As I always say, he's in your, a person is in your head, on your shoulder, and in your heart. And so many people bury themselves when they've lost a dearly beloved, and it doesn't work like that for me at all.
Well, I well remember your daughter coming, concerned about her 2 children, and she wanted to be tested. She said, if my brother has Marfan syndrome, do I have it? Could I pass it on? And of course, Daniel was the first one in the family, so nobody else had it. And we did test her, and she was quite negative. We did echocardiograms on herself, and we examined the children. No sign of it at all. This thing can pop up 1 in 3,000 live births. It's fairly common, actually, and there shouldn't be any risk to any other normal sibling. That was one of the questions that came in, and I'd like to reassure people that you know, it's 1 in 3,000. Everybody runs that risk when they have a baby. But because it pops up just in the baby, there's no risk for the other children, usually.
No, and touch wood, they're well. You
yes,
know,
they're perfect.
Well. Yeah.
Yes, good.
Yeah.
So thank you very much for participating. Have a grand time.
I will.
In New York.
Thank you very much, Carole, for the prize. We greatly appreciate it.
Thank you.
Thank you so much. Continue the good work and your careers. Good luck with everything that you both do together. Well done. I can't praise you both enough. Okay?
Thank you. Thank you.
All right. Take care.
We'll be watching your careers with great interest.